Hey, welcome back to Sunrise. Thanks for joining us. Thanks for staying with us. It's a great place to be. All right, in this segment, we're joined by the head of neurosurgery at the University of the West Indies. He's the medical chief of staff at the Caribbean Neurological Association, the CNA. We're going to be discussing their 23rd annual symposium under the theme Global Health, Technology, and Leadership in Healthcare. Welcome to Sunrise, Dr. Carl Bruce.
Good morning, sir.
Bruce, how are you doing?
How are you doing?
All good.
Yes. I was just talking about football, and Dr. Carl Bruce also plays a very important role there with the J3. So he's an all-rounder.
Yeah, man.
Yeah, one of the greats too, you know what I mean?
Absolutely.
Yeah.
Well, I hope so. But it was great to hear you guys talking about AI just now.
Yes,
and
yes,
music.
yes.
But AI is also infiltrating
The medical field.
the medical field.
How so?
Well, if you think of putting thousands of patients together, and you put the pictures of their spine MRI together, the computer can automatically read and tell you what's wrong and put together the symptoms and give you a diagnosis.
Oh,
So
wow.
it's really taken off, and there are a lot of companies in that space now.
Wow.
Indeed.
And so does that mean better healthcare, quicker service, quicker diagnosis? Because a lot of people, one of the things that they, you go to the doctor, you feel it take a while to get a diagnosis, you take a while to get the surgery done, and sometimes by the time you get done, your condition is deteriorating.
It definitely improves accuracy and decreases waiting time. And so, that first read that the radiologist has to check, in particular in spine, becomes so much easier, and so you can deliver care in a more efficient manner.
I can imagine, just to elaborate on the point, it is so crucial given the fact that early detection or early diagnosis is so critical to fixing the problem. And sometimes people, they lose time because they're, okay, we're testing for this, and then we're testing for that, and we're ruling out things. And then by the time we figure it out, you're at stage 4 or stage 3, or you're far gone, too late to fix. And so it's encouraging to know that you are using the technology to improve the quality of medical service delivery. That helps me to hop straight in. What are some of the contending issues right now, the contemporary issues in neuroscience and technology that are the big talking points in 2025?
Yeah, well, let's start right where you left off. It's a comprehensive conference, so we start from prevention and screening, as you said, because we don't want to get a cancer when it's in your spine. We'd like to screen the patients, have public awareness, because that ultimately also decreases costs and the need for technology. So you want to keep people well rather than treat sick people, so to speak. So we'll explore those conditions, prevention, technology, and then we'll go into health policy to discuss health financing. And this year we have Minister Tufton and Minister Fable Williams, along with our health financing folks like Paul Simpson from Burrito, our title sponsor, and Adrian Stokes, the people in that era, because somebody has to pay for health care, as you know. It's not exactly free.
Right.
But it's that prevention and that same old adage of exercise and diet and taking care of yourself to prevent yourself from getting a chronic disease that we want to explore, and then go into the specifics of treating the different conditions in the neurosciences. But what has happened at the university, the technology over the last 10 years has really improved patient care. Most things are minimally invasive or keyhole now, as we like to say in Jamaica. You'd have seen Dr. Gabriel treating uterine fibroids. In the cardiac space, we don't have to split open the chest and the triple bypass anymore. We have 3 excellent cardiologists, and these 3 ladies will just do dilation and stenting, or they will replace your valve without opening the chest.
Wow.
And then in spine, we don't have to open your back anymore. We just put television cameras in.
Yeah.
Absolutely. So everything has gone minimally invasive to decrease your length of stay in hospital, improve your outcome,
And
get
these are
you back
things
to
that are
work quicker.
happening in
Jamaica.
Jamaica.
These are things which are happening in Jamaica, and we're expanding as we speak.
I'm happy you said it, Dr. Bruce, because many times we hear of these things and microscopic and all of this kind of technology, and we think automatically overseas.
Yeah.
But how equipped are we in Jamaica to do these same surgeries with the same technology so that our people can have access to them?
No exaggeration. Jamaica is one of the only places in the world, talking AI, who has what we call an augmented reality microscope. When you look down, it will navigate for you. it's like you're driving to Montego Bay and you put in the GPS system and you're never lost. So those technologies are available and are available in Jamaica on our platform, in addition to what I told you about minimal invasive surgery.
Yes.
And as you know, at the university, we're about to start expansion for 120,000 square feet of new technologies. We just demolished our old buildings, doctor's quarters, and we're about to start construction to expand this even more.
So let me ask you, Doc, normally when we go to the gynecologist, we know what we're going for. We go to the cardiologist or the hematologist or whomever. But when you talk about the neurosurgeon, like what are the things that would go wrong with the brain? Like, why would I need to come see Carl Bruce?
It's brain and spine. So there are a couple of things that you commonly hear about. Stroke and brain hemorrhage is a big one for us.
Parents say, you're not giving me brain hemorrhage.
No.
Oh, wow.
We got to keep it calm, no stress. But it's one of the things that has also been transformed. In days past, we would open the head and we would go under the bottom of the brain and we'll seal off, clip the aneurysm that caused the hemorrhage. These days, you can use guide wires and go up through the blood vessels and treat it without having
to take off your crown, as you would say.
We don't need to take off the crown for many of these things anymore. And as I said, we invested $3 million in this in the Philips Interventional Suite, along with our health partners and the private sector. And it's really helping public patients and a lot of patients from not only in Jamaica, across the region.
Overseas, medical tourism, I like that part too.
I absolutely like that part because, you know, we are a hub pulling people here. There are many people in North America
who come here,
who come to Jamaica for health care.
And still want their consultation from their Jamaican doctor.
I gotta tell you.
Absolutely, absolutely. And we have a responsibility. We started as a University College of the West
a medical school,
UC as a medical school because of the state of public health in the colonies at the time. And we have maintained those roots to continue to teach doctors and to produce high-quality specialists. And I would dare say that the university, for the region, continues to be good at it.
All right, Doc. So you brought some implements and instruments here, and I'm looking at this one right here. What is this, Doc, and what is it used for?
Dennis, that's very good. That's natural.
Oh.
So you have it right. You've opened it correctly.
Hello.
And essentially, when you have back pain and we say you have a slip disc in Jamaica or a prolapse disc, these days we don't open your back. So what we do is that we go through a scope, an endoscope, and you can just put that down, put it down.
You see that?
And the only thing you'd be looking up on the screen
to find.
and you would be taking it out. So when the operation is finished and you take out this, you've had only a very tiny incision, you can leave hospital the same day. And so our hospital bed that we value so much that we really want to think there, these patients no longer have to stay in hospital for a long period. And this extends beyond spine into many different things. So if it's a little bit, held up, you just put that down and you scratch it out.
Right.
Yeah.
So it's still scoping.
Yeah, and then you use the other one, you had to take it out. And if you want to keep the area clean, this one, you just put it down also and you seal any little oozing or any red blood cells you see coming from the skin edge. So all of it goes through the tiny keyhole.
Wow. So I remember when I used to take out my mommy's laryngoscope. And I'm like, how does this go in somebody's throat? What?
Yes.
The larynx? What?
Yes.
And then, she'd have her stethoscope and you listen and then to think. So when I'm looking at this, it actually is reminding me of some of the things that I used to see in my mom's bag. You know what I mean?
And the amazing thing now, even the laryngoscope technology is infused. So she used to use her eyes and look down. Now they attach a camera to the end of it. So when it's going down, when she's putting the patient to sleep, you can actually see exactly what you're doing on the big screen. So it's amazing. Technology in medicine is like computers. Absolutely.
So, Doc, so who is this conference for? Who is the symposium for? Who do you want to come to it? And where can we come to learn about this? Because, Dennis, I'm very impressed that it is happening right here in Jamaica.
Well, we are at the Half Moon from Thursday, the 30th to the 1st.
That's tomorrow, Thursday. Well, tomorrow's Wednesday, then Thursday, yes.
Yeah. And we go for 3 days at the Half Moon Conference Center in the Half Moon Shopping Village. We want all of our healthcare workers, physiotherapists, speech therapists, nurses, doctors, wherever you are in medicine, we have something for you. Even the health policy people finance people, as we said before, because we're doing our continuing medical education. One of the great things about medicine in Jamaica, we're always updating ourselves.
Yeah.
So this is our update. You get to score your points. We even tell you how to take care of yourself, how to get rest.
You mentioned score your point because it's important that doctors constantly have to be doing continuous learning. And
doctor's education. In law, we have continuous legal education or CLE. You have to have your points.
So you do, this does
provide their continuing medical education.
Nice.
It updates them, new medications that come about. We have new drugs that we're discussing now for Alzheimer's type disease and memory issues.
Wow, Parkinson's and stuff?
We have new injectables for cholesterol that we want to discuss. So you want to exchange that knowledge and be interactive. And the team at Half Moon have always done a great job. I want to big up Mrs. Logan, Mrs. Savage, Mrs. Dobbs and their team. They tolerate us and we bring in all this equipment and they have to find everything and internet and electricity to ensure that we literally can set up an operating room and demonstrate at times.
Wow, I love that. Absolutely amazing.
Brilliant.
And where can we get some more information, Dr. Bruce? So, for example, you said it's from Thursday the 30th to February 1. Say, for example, you're not able to make it every day, but you want to get information to get your tickets and so on and so forth. Where do we go?
Absolutely. You can visit our website at uwicans.com. and you will get all the dates and the registration information there. Also, you can call the Department of Surgery at the University of the West Indies, 927-1270. That's 927-1270. And the team there will allow you to register and make sure that you get all the information you need to, get your update.
All right, sounds great. Sounds great, and it's so important for persons to, the doctor, you need to get your points up. So
Well, let me just ask you quickly, Dr. Bruce. We know how to protect our teeth or our heart. How do we protect? Give me just 3 things we can do to protect our brain and our spine.
I think like every chronic disease, there are a couple of things we say. You need to be fit. You need to make sure that whatever you're putting in your body, it's useful. So we want you to focus on your diet. And we want you to focus on your exercise. Because ultimately, what happens is the complications of the chronic diseases that cause most of the problem. Diabetes, hypertension, elevated cholesterol, cancers. I think if we can prevent those, then we can deal with the other things that emerge. And so diet and exercise, that little walk that you don't want to have, that little break that you take from your desk, those are the steps that you count when I guess everybody has a watch that counts steps. Or don't take the elevator sometime, take the stairs. Those things really do matter.
Thank you, sir.
They matter.
Wonderful. All the best to you and your team. Love it. I'm loving this. Half Moon, Dennis, can go learn some things.
Can go learn.
I'm always wanting to learn. Yeah, so we can spread the information.
You sound like you could do a thing with a thing there. The
No, I just hold the light. I just hold the light because I'm gonna get nervous. I'm like, Doctor, you want to hold the light? I'll hold the light. Yeah.
Nurse Hilton, you took her to the water, but you couldn't make her drink.
No, I'm the legal brain. No, I'm just gonna hold the light. Okay. You intubate the patient yet? All right, you got no. All right. Okay, I hold the light. Yeah.
You see the amount of knowledge there? Intubate the patient. Absolutely. It's a start.
Our guest has been Dr. Carl Bruce, Head of Neurosurgery and Medical Chief of Staff at the UHWI. Coming up after the break, it is going to be time to look into the effects of the new U.S. immigration policies and orders. You don't want to miss it because there's a lot of speculation going on. Let's get the real information. Stay with us.